Hello everybody, thank you very much for joining us for another episode of this series of video interviews, Survivor and Success in the New World. We have a wonderful guest with us today. If there is one professor that I would love to learn from, he is none other than Professor Ngoh Tiong. Professor Ngoh Tiong used to be a professor at the School of Social Work in the National University of Singapore. He was also the former Dean of the School of Human Development and Social Sciences, which is currently known as the S.R. Nathan School of Human Development. He has written many books and published many academic papers. His field of research is broad. It covers everything to do with social work, social change, and social entrepreneurship. He had a very interesting project. He was the chair of FAST, F-A-S-T, which stands for Family and Survivors of Tsunami Project by the International Federation of Social Workers and Commonwealth Organization for Social Work. So Professor Tan, thank you very much for joining us. I have a very interesting question for you at the beginning. Singapore have our version of the circuit breaker measure, and this term circuit breaker is now being adopted in many countries. So how has the circuit breaker measures been treating you?
Well, that's a good question, Patrick, and thank you for the kind introduction. As with everybody, this is an unusual time, and at first, me and my family were pretty cautious. We stayed at home most of the time. We kept to the news, what's happening, and there was some anxiety. And then there were people who said that we should get out, and so we go to the neighborhood for a walk individually and then as family. And when things loosen up, I think the walks become more common, and it's good to get out, but be safe. So with one or two friends, we go for walks. I think what is important in the circuit breaker time is that we have reorganized our lives, and we tend to then spend more time in interaction with family, and also over the social media, over WhatsApp, with friends, and get connected in a different way. So I think those are some of the initial and response, and I think it's a good change in the pace of life, and there's readjustment that is needed.
Okay, very good. Dr. Tan, you were involved in disaster and crisis management as a social worker during the tsunami and Sichuan earthquake. Tell us, what do you do and what do you learn from this crisis?
Well, that's also a very spectacular time in that it was unprecedented. The way the earthquake happened in Aceh area, and then the tsunami that hit many countries in the Indian Ocean. I was involved because I just stepped down as the regional president of the International Federation of Social Workers, and together with my colleagues from all over the world, we started the FAST project. And the idea of the Family and Survivors of Tsunami project was that we have to help people on the ground, but with the local organizations and local groups, so that there is capacity building and sustainability. So we started 4 projects, one in Aceh, looking at protection of children and training child welfare workers, and that was in partnership with UNICEF, and the local organization was the Indonesian Associations of Social Workers. Then in Sri Lanka, we started 3 projects with also the Sri Lankan social workers. One with the widows who had suffered during the tsunami, and they lost their husbands and livelihood, and they had a therapeutic garden that was constructed with the help with the local agriculture department. And they were able to sustain some of their industries by selling herbs and plants and a new kind of livelihood. So the project was continued again with another organization so that it's sustained. There was also therapeutic groups with children and orphans. Also another on social enterprise. So 3 or 4 projects in Sri Lanka, and then in Tamil Nadu, where the tsunami hit the hardest, we had a project on mental health, and it was training social workers to meet the mental health of the families that were involved. And in Thailand, we had an online education program on the tsunami and how to prepare for it, and it's in both Thai and English. So we were able to garner the resources of the local groups, and they were able to develop those programs and sustain them over the time. So you asked, what did I learn? I think the key lesson is that we know people are very resilient. People can cope with their situation, and people will try to bounce back when there's a crisis, when there's a disaster. But we find that resilience has many dimensions. The environmental resilience, for example, how you're going to prevent future floods and earthquakes and tsunamis. It's to develop houses or places of safety and buildings, and make sure the environment is not depleted of trees and shrubs that are preventing the floods or such. So the environmental resilience is a key factor in dealing with climate change and the whole environmental crisis that we are facing. There is also the community resilience that is very important, that neighbors know each other, help each other, especially the more vulnerable neighbors. And so I find that neighbors who reach out to others and then in times of crisis to be able to support and also resource each other. Like what we have seen here in Singapore, also those who are under home quarantine, neighbors who bring food and supplies. And also in our Singapore context, there is also training in disaster preparedness, fire drills, and all that in the community, and the People's Association have done a good job in that. So community resilience. But we found one factor in our study in the earthquakes in China, in Sichuan, was that people who recover better have a sense of community. People will feel that they are not alone. And although the physical recovery in terms of, say, housing and financial health is important, the social resilience factor is correlated with decrease in depression and greater satisfaction and hope in life. And I think the hope factor that human beings have is in relationship, in social factors. So I think these are some of the key things I've learned.
Thank you very much for giving us a more holistic definition of resilience. I have been enlightened now. Now I know that you're not alone, and you'll be better off if you work with your friends, with positive relationship within a community, as well as together. See how you can build resilience for the environment and towards improving the environment. So thank you very much for that beautiful answer. You mentioned just now about mental health, and this is one of the biggest issues as far as the pandemic is concerned. So I would like to ask you, how do we take care of our mental well-being?
Okay. We must first realize that health, mental health, and well-being are all connected. It's not just a physical phenomenon, it's social, and it's also spiritual in some ways. So what is happening in the lockdown period is that people tend to be isolated. And when you are isolated, there is the feeling of anxiety, fear, and sometimes depression sets in, especially when you don't know what the future would hold. So the government has come up quite well in terms of the first approach was social distancing, so that we may not transmit the virus to other people. But it's not so much social distancing, it's not so much for social distancing that is the issue. It's the safe distancing and the physical distancing, so staying 1 meter apart. But because of that, people may be socially distant as well. So I think what is important is that physical distance does not equate social distancing, and we should continue even more to be in touch with our loved ones by phone, by WeChat, by video calls, by WhatsApp, so that you can build strong supportive network. I think the important thing in mental health is, as I say, a holistic approach where you need to have physical well-being and take care of your physical health, but look out for others physically as well as socially. Look out for the needs of your friends, your family, especially those who are elderly and those who are very young. And I think make sure they are healthy, make sure they are active, make sure they stay safe, make sure they cope well, and continue that kind of support for one another. And if things are working out not so well, there are also helplines and calls, for example, with SOS. You can speak to someone if you're very anxious or you are very depressed. And if you cannot contact them, leave a message for them to call back. So there are national hotline, the care hotline, there's the SOS. I still remember the SOS number 1-800-221-4444. That's a number you can call. There's also a list of number of hotlines that the government has given on the website.
You know, I'm glad you mentioned this because during the circuit breaker measures, we encourage our people to spend adequate time to call their family members, their loved ones, their friends and their contacts to try and encourage them, motivate them, inspire them. And one of the benefits we discovered while we were doing that is while we were trying to encourage somebody, we were also encouraging ourselves. While we were trying to inspire somebody, we feel inspired to do more and do better in life. So I'm really happy you mentioned this, and this validates something that we all should be doing for each other as we build this sense of community resilience and improve all our mental well-being. Thank you so much. I have another very interesting question. Assuming you are the leader of your own organization or your own team, what can you do? What will you do during these challenging times?
Well, if you are a leader of an organization, you have employees as well as subordinates, or you can have colleagues that you have to look out for. This is a time where there's uncertainty because of the circuit breaker and the lockdown, job insecurity. People are at home, there's social isolation. If they are working from home, then the way they balance work and family life, I think these are concerns. And I think as a leader, you should recognize and empathize as well as provide support. For example, some assurance on the job security and restructuring those jobs so that they can perform adequately, and helping them with technology if they need a microphone or earphone or a computer with Zoom or other networking, so that you can also help them to structure a time and a place where they can work And I think what I've found is that there need to be some kind of border between work and home. So if they can structure some kind of space where they can go in to work, it is helping them to have that kind of time out from the family. And also, I think we need to check regularly and be flexible about our working hours and give them information on the job itself, the requirements, their salary, when they will get their salary, whether they need counseling and support and encouragement. I found that some companies are very good. They send chocolates and letters and cards and even grab food,
Thank you for talking about us.
Yeah. So I think these are important little things, but if you do it with concern and connection with your team, then you are doing well.
Very good. I'm happy you said that. Really, what you just said resonates with me.
Yes.
The reason I say that is because we have a saying: if you are a leader and you don't have a heart to love and serve your people, you don't qualify and deserve to be a leader. One of the worst heart disease is not to have a heart for the people and environment. One of the worst heart diseases is not to have a heart, for the people and the environment around you. And if you are a leader with a heart, you certainly can strengthen your output, results, and impacts. Okay, I think we had a really wonderful time. You have shared something that I believe have enlightened, inspired, and encouraged our audience out there. Do you have any last words, any last message for our people out there?
Well, like you say, do things with a heart and keep in touch with your loved ones. Keep on in contact, messaging, WhatsApp, Skype call. And I find that I can even now reach out to the world, not just Singapore, with this. Keep active, keep occupied, maintain good sleep, diet, rest. Keep on looking up and pray always. Keep the hope and spirit high. We will get through it together.
Wow, thank you so much. I hope all of you out there, you're inspired by this wonderful message that Professor Tan has brought to all of us. The reason why we run this series of video interview is to bring positivism, hope, and optimism to the world, especially during these challenging times. Without positivism, without hope, without optimism, then we will not be able to rise up. We will not be able to take ourselves to a higher level in life. I hope you're inspired. We'll look out for the next episode on our series. Thank you.